have weak grip? Are you getting pain into your wrist, your thumb, your index, middle and half of your ring finger? Or you may be getting some numbness and tingling? You may be suffering from carpal tunnel syndrome. Today we're going to go over what it is and how to fix it. Carpal tunnel is in your wrist and it is made up of the wrist bones or the carpals, which are the underside. And then over the top you have the transverse carpal ligament, which is sitting over the top. So this is forming a tunnel, and in through this tunnel you have a bunch of tendons which are operating the hand movements, and you also have the median nerve passing through the wrist here. The median nerve is responsible for these medial 3 fingers and half of the ring finger, so that's why you can get some pain, some numbness, some tingling and some weakness in through there, and you can also get the wrist pain and a little bit into the forearm as well. With carpal tunnel syndrome, it comes from there being a reduced space. So as that median nerve is trying to pass through into the wrist to supply the hand, you're applying pressure or compression on that nerve, and it's resulting in the symptoms in through the hand and the wrist. How to fix carpal tunnel syndrome. The most important thing you can do is avoid aggravating activities. So often it's really occupational, so people will do repetitive stress through their wrist throughout the day. So this is people using keyboards in the wrong position, so they're constantly extending when using their mouse and their keyboard. It's people using power tools, painters and things like that. So it's a really repetitive motion. We want to try and avoid that. We also want to encourage you to splint. So use splints that you can get from your pharmacy, from your local physio, and this will really support in through the wrist, really open up that space through the carpals there. And it's also really important that you're wearing that brace at night, because at night you really fold up in on yourself, and that really reduces the space that median nerve has to travel through. Today we're going to go over a couple of different exercises to help with your carpal tunnel syndrome symptoms. The first ones we're going to go over are some gentle wrist range of motions. So we're going to start on the most simple variation and build up to the stronger exercises. So firstly we're going to start just with wrist flexion extension. We're going to have a bent elbow dropping forward and back, and you can do that up to 10 times. If this is far too easy for you, you can do it with an open hand. If this is too easy, then you extend through the elbow. You're starting with the wrists. And if this is too easy for you, you're straightening out through the fingers and opening through here. If this is again too easy for you, you can apply over pressure through the wrist there and hold that up for 30 seconds. For the range of motion exercises, we want you doing up to 10. We really don't want you to try and really flare up the area. So doing about 10 of those, repeating 2 to 3 times a day. This last exercise we're going to go over is called a nerve glide, and we're specifically going to be targeting the median nerve, so the one responsible for the hand symptoms in carpal tunnel. So for this, we're going to be in a relaxed position, usually seated, and we're going to start off with the most gentle motion. So we're going to bring our arm out to 90 degrees, and this may be enough of a stretch for you. If this is the case, you can gently drop your head over to the side up to 10 times, and you can even do it the other way. So bending through the arm until you're getting a nice stretch all through the arm, and you may get some of those symptoms in through your hand. If this isn't strong enough for you, you can drop your wrist backwards, dropping that down, repeating that up to 10 times. And you can also, at the same time, drop the head down and up, doing this up to 10 times. You get a gentle stretch, and what this is doing is actually gliding the nerve through its path and making sure there's no extra tension through that nerve. That was it, a quick explanation of what carpal tunnel syndrome is and how to fix it. I hope that helped, guys. We'll see you soon.